Hi, and welcome to the Bad Ass Breastfeeding Podcast, co-hosted by Abby Fearing, the Bad Ass Breastfeeder, and Dianne Cassidy, IBCLC.
Welcome to the Bad Ass Breastfeeding Podcast. I'm Dianne, your lactation consultant.
I'm Abby, the Bad Ass Breastfeeder.
And the Bad Ass Breastfeeder isn't feeling good. She's kind of under the weather.
I'm sick.
So we decided that in celebration of Abby's cooties, or whatever it is that she's got, that we're going to talk about being sick, because I have had a bunch of people calling me too, saying, I'm sick. What do I do? Can I still nurse? Can I take something? I mean, everybody, it feels like right now, this is just the time of year, at least where we are anyway. Maybe you guys are all somewhere sunny and beautiful where the flu isn't going around and the cold and everything else.
If you're somewhere warm, we don't care. Don't talk about it. Don't tell us.
It's seriously cold where I am right now. Abby, what's the temperature where you are? I know it's cold with you too.
Let me see. Yeah, we've had like a massive... It's been colder here lately than it's been in many years. Let me open my weather app.
Yeah, us too.
And this like screaming baby who's also kind of sick.
Aww.
What is it right now? It is 17.
Yeah, it's about...
That's pretty toasty compared to what it's been. It's been kind of sub-zero since Christmas.
Here it's like 20, which is a little bit warmer, but then they've threatened us with like not getting past like minus 25 below by the weekend. Like, I'm not even kidding. It's like supposed to be negative 25 below. Like, yeah. Really? I no thank you.
Yeah, and I have a cold, and it's like, I think it's just too, like, I don't have a runny nose because I think it's just too cold and dry. Like, it won't come. It's just it's all congested, giving me a headache, and it won't come out because it is also scared of how cold it is. Like, no, this is not, we can't.
It's ridiculous.
It's just stuck inside.
So what do you do when you get a cold and you're breastfeeding? Like, what happens? Or you're sick, or you've got the flu, or you've got God knows what. And you're breastfeeding.
Know people. Yeah, and like, should you breastfeed? Because aren't you going to get your kids sick too? And shouldn't you keep a distance? Shouldn't you put them in a bubble in the other room?
I know you don't want to sneeze on them or breathe on them.
Right.
Oh my God, because they'll never get anything.
But I guess here's the thing: sneeze on them and breathe on them.
Rub them up against you.
And breastfeed them, because they're going to get sick. And then if they're breastfeeding, it might be a little more mild because they have all your antibodies.
And it's really kind of cool. So your body, obviously, I mean, we've talked a zillion times about how your body knows just what to do for this baby. Mm-hmm. So your body...
Another instance.
It is. Yeah. And your body's making the antibodies right now while you're sick. So right now, while Abby's sick, her body is fighting this cold and passing those same cold fighting properties onto Exley and Jack if she's nursing them. So that's what your body is meant to do. So more than likely your child is not going to get sick because you're passing them these immunities right away.
Well, and if they do get sick, which is totally normal.
Right.
It can be a little less severe and last a little shorter.
Right. So the things to kind of watch...
And breastfeeding feels good when you're sick. I'm not necessarily for the mom, but for the baby.
Right.
When baby's sick, like, that's going to just help them feel better.
I know, it's just more comforting for them. So a couple of the things that can happen, and we'll talk about... I'm trying to decide if we should talk about the baby first or the mama first. But, so if the baby is sick, we'll go that route. If the baby is sick. And that could even have more the baby's sick and you're not. So, that can happen too, especially if you have other kids in the house that are bringing home germs from preschool or from grade school or, daycare or whatever. So maybe your baby's really congested and stuffy, and that can make it hard for them to nurse. They can't breathe easily.
Yeah, totally.
So that might make it a little hard. They might be a little bit fussier with that. They might be, do a few sucks and pull off because they're not breathing well. That's totally normal. That's okay. I had a mom today call me and say, well, should I just give bottles? Because I feel like it's kind of hard for the baby to nurse. Well, the first thing I would say is, is it bothering the baby? Does the baby seem fussy with it? Are they crying? Or is it just taking extra long? And if they don't seem fussy and they seem like they're tolerating it okay, then I would say keep nursing them. Keep nursing them as much as they want. They might want to nurse a little bit less just because, how when you don't feel good, maybe you don't have as much of an appetite.
Yeah.
But make sure the baby's hydrated. So if the diapers are still good, we're good. Just kind of follow their lead. do what they want to do. But if you notice a drop in the wet diapers, then I would say make sure you're getting some hydration into that baby for sure.
And how can you do that?
You might have to give a bottle if they're not
what
nursing.
if they, oh yeah. Right.
Yeah, of pumped milk. Yeah. But they usually do just fine. They really usually do just fine. They kind of nurse because, like you said, the nursing helps them feel better.
Yeah. Yeah, and you can try to clear the airways a bit. You can go, like, we are big on steams in our house. We go into the bathroom, turn the shower on hot, and then just sit in there for like 15 minutes.
Yeah.
If your child has curly hair, it'll make their hair awesomely really curly. And you can pretend in the middle of winter that you're on some beach somewhere in a really hot place. But that'll help, like, loosen things up. And then, but they might even not even have had this when your children were very small. But the nose Frida.
I was just going to say that we did not have it. And I have a friend right now, a good friend who's an ENT who just had a baby. And he totally brought one of those home. He's like, these things are great. Because it's, and it might seem gross, like you're sucking the boogers right out of there, but they work really well.
But you are sucking the boogers right out of there, which means they're going to be able to breathe better, and they're going to be able to sleep better, and they're going to be able to nurse better. And these are all things you want when everybody's sick, because
Absolutely.
Everybody needs a little extra naps.
The other little magic trick, of course, is put a little breast milk in their nose. Because that'll clear it up too.
Yep.
Yeah, all that congestion. And remember, like their little nasal passages are pretty small, so it's easy and they can get pretty swollen and congested very easily, much easily than we could. So
that's the thing that happened with Exley. Like 3 times in a year, he got croup, which is basically just a cold, but their airways become so swollen that they are actually struggling to breathe. It's so baby. Scary. And he's actually falling asleep on me right now. So he had to go. We had to get, it got so bad that we actually had to do, you can do, like, they say these things like bring him outside if it's really cold and like try to get the swelling down, but he had to have steroids. And, but that's scary. All that stuff is really scary. Kids being sick is really scary, first of all.
It is. It's very scary.
Like, no matter what they, I think it took, like, having a second child and having everybody get a little bit older for me to be like, okay, they have colds. Like, having a newborn, it's just panic. Even if it's a small cold, you're like, oh my God.
I know.
What's happening?
You just want them to feel better. And when they can't tell you what's wrong.
Yeah.
And it's like you don't want to, dope them up with medicine, and it's hard. It's hard to kind of get them through it.
It's hard to know when to give them medicine and when to, like, let them ride it out. And I've noticed that as my kids have gotten older, that it's a total judgment call.
Mm-hmm. Yeah.
In the.
Especially in this day and age where everybody's on antibiotics for something. It's like, okay, so what's treatable, what's not treatable? That always confused me. Some ear infections are like, that's not bad enough to treat. And someone's like, okay, that one is, or some things are, that's a viral thing, or that's a bacterial thing. It's like, how do you know? Everything seems the same.
I've learned so much about that just becoming a parent.
It's crazy. But I grew up in one of those houses where it was like, unless you were on fire, you didn't go to the doctor. Like, you just, you dealt with it. And thankfully, my kids are, they're pretty healthy with the breastfeeding. I'm so, so, so grateful. And they're older now, but when they were little too, but it's like, I was always afraid, oh my God, are they going to get something? Are they going to get sick? What's going to happen? Mm-hmm. What do you do?
Yeah, in my house growing up, we got Robitussin. You got Robitussin for everything. You could fall down and scrape your knee and get Robitussin. Yeah. Actually, I think that's a Chris Rock joke. I think I just stole that.
It's totally a Chris Rock joke.
It's true. But it's totally true.
Oh, yeah.
My house was the exact same way. And the generic brand, Tussin. Yeah. I think that was the Chris Rock one, Tussin. Yeah, I think he had a whole Robitussin bit.
Yeah. But now, so if you're the mom that's sick, so we already determined that you continue breastfeeding.
So if you have a cold, if you have a stomach virus, Like whatever it is that you have, just keep breastfeeding.
Yeah, absolutely. Keep breastfeeding. But can you take
You
anything?
don't have to worry about harming your child.
Right.
Like just go ahead and do what you're doing. And so, yeah, that's what the question is always like, well, what can I take?
What can you take? Right. So that is a huge question. And a lot of times people will ask their doctor or their pharmacist, sometimes, because of course on the box of anything you look at, it says if you're pregnant or breastfeeding, don't take this.
Right.
Most everything really is okay. It really is. So the things that we need to consider are, okay, how old is the baby? Is the baby breastfeeding all the time? How often do you need to take this? And how long do you need to take it for? I mean, is it something, because sometimes people call me and they'll be like, I've been trying to hold off, but my head is just killing me. It's so congested. I just need to take something like once and I'll be fine. Mm-hmm. That's fine. Is it something like that? Or is it something that you're going to have to take for 3 or 4 days every 3 or 4 hours? There's a huge difference there. And you know what it is. Typically, if you can take something that is less, what's the word I'm looking for? Like less overwhelming. So the things like the NyQuil where it will cover 15 different symptoms. Obviously, right. That's going to have like way more medication in it than something that's just going to be like, this is for your pain. So try to kind of like keep it lower, keep it at a lower dose.
Try to treat like the most bothersome symptoms. So if you have, like when I got sick, the beginning of getting sick was just a wicked sore throat. And I knew I had a cold and the sore throat was so bad. I just steered clear of the cold medicines because I don't like the way it makes me feel. There's a lot of, you feel doped up. And so I just took some ibuprofen to kill the pain of the sore throat and just dealt with the rest of it.
Yeah, that's a really good point to just kind of like go with the worst symptoms first. The thing that I worry about, I don't really worry about like, oh my gosh, the baby is going to get, some part of the Robitussin passing to them or whatever.
Yeah,
like that's
right.
the least of our concerns. My concern is more of like, is it going to affect supply somehow?
Oh, yeah.
Because a lot of things like Sudafed, that's made to dry you up. Like that Sudafed,
So I never thought about that. So like these medications they're designed to go in and dry up all your mucus. They're going to dry up everything.
Yeah.
Wow, I never thought about that.
Yeah. So things like Sudafed I always try to steer away from, Benadryl, certain, like some people have chronic allergies and just take stuff all year long. And there are certain ones that are fine. And then there are certain ones that are not fine. So you really have to, those are the things you have to be more cautious about. I feel like it's not, the actual, the medication is going to be bad. And if you had to take a NyQuil, it's not the end of the world, really.
Yeah, right. And then exactly, like it's not the end of the world. You could totally take NyQuil.
Yeah.
I would say something like with NyQuil, again, it's kind of like when you're talking about drinking, like don't share a bed with your baby because it will knock you out. You won't, it'll be difficult for you to wake up. You won't be as aware of things going on around you as you are when normally.
Absolutely.
So I would just be cautious of that too.
Absolutely. And if you are sick to the point where, and everybody handles it differently, but if you are sick and you're like, I need to get a good night's sleep, I feel awful, I feel miserable, I have a fever, something like that, it's not going to kill your breastfeeding to need to take a break a little bit either.
No. Go ahead and take the NyQuil, just put your baby in a bassinet.
Right.
And then pass out. Go ahead.
It's fine. And just go back to breastfeeding, when you're feeling a little bit better. Mm-hmm. But don't, it's not the end of anything.
Right. Right.
It's perfectly okay. Now, any kind of prescription medications for being sick, like antibiotics or anything like that, all of that is fine too.
Yeah, see, that's the thing is like people, because again, people are going to their doctors saying, what can I take? What can I not take? And the doctors are not trained in lactation, so they don't know. So they're always going to err on the side of caution and say like, okay, well, don't take that, or that's not safe. And that's really not that's not the accurate information about the medication.
Right.
And I had in Jack's, when my first son was like 2 years old, I got this terrible, terrible ear infection.
Oh.
And it was awful. And I went to this ENT and he said, so, I don't remember how it happened, but I said, I'm breastfeeding and I want to make sure that, if what I take is safe. And he said, okay, well, I'll just give you like a mild antibiotic then to put in your ear. And so I was like taking this. I took it for like 3 days. It did nothing. Basically, it was like hydrocortisone drops.
Oh.
So my ear infection got really bad. Really bad. And I was like beside myself. And this lactation consultant, who's also a medical doctor, was a medical doctor first and went and became a lactation consultant. Dr. Jen, I don't know if you know Dr. Jen.
Oh, yeah.
Yeah.
Yep.
Okay, so she saw, like, I posted on Facebook about how bad my ear. I had saw her the weekend before. She was like pulling on my ear, and I said my ear kind of hurts, and she was pulling on it and looking at it, and she was like, I don't know, I don't think you have an ear infection. And then it progressed through the week. So then I went to this ENT, and I have this mild. He's putting this hydrocortisone crap in my ear. My ear infection's getting worse. She sees on Facebook that I like posted about being in pain, and she's like, what are you need to get the Ciprodex or whatever. I can't remember the name. It's like the really strong, drops. Mm-hmm. And I was like, I don't know. He said it's too strong, that breast milk. And she was like, it's not going to get in your breast milk when you put it in your ear.
Right.
And I was like, oh yeah. Like I never even thought to like look at it from like a common sense perspective because I was just so worried. I was just like, okay, I don't know. I don't want to do anything to hurt my baby. And then the ENT, who doesn't know anything, was like, okay, well, we'll just do something mild. So there's two people who don't know anything, sitting around while my ear infection got worse. And so finally she was like, you stop it. Just put it in your ear. Put the Cipro stuff in your ear. And I put it in my ear, and like the next day it was gone. Ear
infections in adults is horrific.
It's I know, and then I'm parenting. I mean, you can't. I couldn't. I would have just walked into traffic if it had gone any longer.
Yeah, it's bad.
It was so horrible, and you can't just like take ibuprofen and like all these painkillers. It doesn't work.
No, and then you're doped up on that. So, but you've got a really good point. So things that are like topical like that,
yeah,
those are fine. Unless, like,
it's not going to get into your breast milk.
Right. It's fine. And, like, people will ask me about that, too. Like, about steroid cream. I need to take the steroid cream for a rash or whatever. Is it okay? It's like, is it on the nipple? If it's not on the nipple, it's fine.
Yeah.
It's, all kinds of crazy stuff comes up. I've had, poison ivy and, just all sorts of things. If it's topical creams, acne medications, all of that stuff, it's fine if it's topical. It's not getting into your system.
Yeah. Yeah, but it's funny. It's a good example of like how irrational moms are.
Right.
It's like we just can't, we're so worried about our babies that we can't, like I couldn't see this situation like logically or from like a place of common sense. Like, oh yeah, how in the world would it get into my breast milk if I put it in my ear? Like it's not, these systems are not connected.
I know.
When it said, I was just seeing it through, worry, and that's all.
It's crazy. It's like worth it to just do what you got to do. So if you get advice that you're not sure about, if it's something like that, if you go to your ENT and he says, I can't give you anything because you're breastfeeding, I can't give you anything in your ear because you're breastfeeding, don't hesitate to get a second opinion on that. It's totally okay.
Oh, yeah. Yeah. That's actually a good idea.
Yeah. Or anybody says to you, don't take this while you're breastfeeding. Please ask somebody if you're not sure.
Yeah, and they have these great, like, just call lactation center. They have that infant risk website.
Mm-hmm. LactMed is really good.
Yeah, LactMed. Yeah, the LactMed has an app on your phone. You can just download the app and put in whatever it is that you're questioning, and it'll tell you whether it's safe or not, and it's going to just say that it's fine.
Oh yeah.
It's very rare that a medication is not safe when you're breastfeeding.
Right, and it is very rare. I mean, like, it's not very often that I've had to tell somebody not to take something, and if I did, it was probably because it was a mixture of medications. Sometimes if it's like there was one mom recently, last several months, who the baby was newborn. So she was still actually in the hospital. And of course, when they're that small, the risk of anything is, higher because they're so little. But the mom was on several psych meds, I think it was, like several, and then I think some other things thrown in there too. And it was like, all right, this might not be a good mix for a brand newborn.
Yeah.
But you really have to think about, like, do the risks outweigh the benefits?
Well, that's
the benefits outweigh the risks.
You have to weigh that too, especially if you're struggling with psychiatric issues or something. It might be a situation where you're talking with your doctor, where you're going to decide that that's the best thing, and that's why you work with a doctor.
Exactly.
But we need to have an educated doctor. I had a woman emailed me one time that she had her head was completely shaved, and she had like brain surgery, and she had clamps all the way across her head from this incision.
Oh my God.
And she breastfed through the whole thing, through the whole situation, and she said that she used, with her doctor, the Dr. Hale's book. Mm-hmm. And he's the guy who's done like all this. He's the guy, like,
yeah, he's the medication guy.
Yeah, he's done all the research and all the whatever about breastfeeding and medication. And she worked with her doctor on that, with all of the, safe meds and stuff like that, safest meds. And she was able to breastfeed all the way through like brain surgery and recovery and all that stuff.
It's really pretty amazing, how much we don't, like you were saying, like you just, like the common sense part of it goes away. And I had a mom last week who was getting like emergency gallbladder surgery, and she, was asking me about, what do I do about the breastfeeding? And it's like, as soon as you can hold the baby, you're fine. And, they, even with anesthesia, it's fine.
Well, that's what somebody said something to me too. She was like, what about the anesthesia? And I don't remember who said this, but somebody said, well, when you're awake, that means the anesthesia is gone.
Yeah.
Out of your body. It's like made to put you out. So when you're awake, that means it's not in your system anymore. So you're good to go. And then,
like,
oh yeah, that's right. That makes sense.
And we have mom with C-sections that have been put under general, or that are on, pretty heavy duty pain, morphine, or, Percocet, that are breastfeeding these brand newborn babies. So if you're having a surgery at, however many months in, it's fine.
Yeah. Like when I think about just like my normal vaginal hospital birth and the amount of ibuprofen that they had me on was like 800 milligrams every 2 hours or something.
Yeah.
Like, and this from the people who are like, no, don't take the, whatever cough medicine while you're breastfeeding. Or like, don't know anything about anything else, but they don't see, they realize that it's not an unsafe situation.
Right.
In that case.
The other thing that's cool about the Hale book, which I really like a lot, and I'm pretty sure it says this on the Lactamed, but I can't remember off the top of my head, is that it gives you like the dosages. So it'll even say, like, if you look up a medication, it might say, dosage between 300 to 500 milligrams or whatever. I'm just kind of throwing that out there.
Oh, yeah.
So that way, when a mom calls me about a med and I say to her, well, what's the dosage? And she says, oh, I'm going to go on a really low dose, like 100. Like, you know what? The studies that they've done are for 200 to 300 milligrams and says it's safe. So if you're taking 100,
you could even go higher if you're in pain or something,
right? Or so it's like it gives you a really good idea of where you are with things, which is nice. And a lot of times in the Hale book, if it says that it's unsafe, it's really only because it hasn't been studied adequately.
Exactly.
Not because it's technically unsafe.
Right. It's just that there's no research at the moment. Yeah.
Right.
Yeah. Interesting. Yeah. Well, and so I posted about this on my Facebook page the other day about being sick, and we got into a really detailed conversation. This woman posted a picture of herself breastfeeding her baby next to a bucket.
Oh, poor thing.
Actually, it was a bowl. And there was like a long conversation underneath the post about like a better container to throw up in. You know, it was like,
God.
no, that bowl is too shallow. you need a deeper bowl, possibly a bucket. And like everyone was like giving their advice on like the best things to throw up in while you're laying next to a breastfeeding baby.
Oh my God.
It was funny. It was like, okay, here we've all been there.
So what did they all decide was the best?
Well, so some people were grossed out by the fact that she was using something it was like a cookware or something.
Like, now she's going to go make dinner for her family right after.
Oh, no. And somebody was like, well, just put it in the dishwasher. And then I was thinking about how we eat out of the bowl that I had Exley's placenta in when I had our home birth.
How fun.
And I'm like, that's like, I mean, it's like I'm like in love with this bowl because it had his placenta in it. So it's special to me. So like whenever I throw some food in it, I think it's great. But, you know, people are like, what? I'm like, well, it's been washed.
Right. It's not like you just took the placenta out and put your dinner in it.
Right. I didn't wipe it with a paper towel. Like, I mean, it's been in the dishwasher, soap and everything. Yeah. But then other people were like, the bowl's too shallow because if you're not really in a good position, you could miss or it could spill out. But I don't know. You know, I'm like, are you guys like projectile vomiting because I don't really have that. I don't have a lot of sprayage. It's just... These are things, I guess, things you have to think about. Well, and also, like, people, I thinking about being grossed out by vomit. I mean, like, how many times, at least my kids, if they're sick and throwing up in the middle of the night, I'm not getting up to change the sheets. I throw a towel down and we all go back to sleep.
Oh, my God, I know.
Like, I think when you become a mom, a lot of this stuff, it's like, I'm not, you got to take down the gross, the grossed out thing down a notch. Because you can't have time to be grossed out about everything.
No, you can't. And it's just kind of like the way it is. But, of course, then the more kids you have and the more you're involved in it, the more used to it you are.
Yeah.
And it's, it just depends. Some people get really grossed out by certain things and some people don't. I am not, like, with germs, I'm not a huge germaphobe. Like, that does not bother me at all. And I just did a home visit right before coming home and doing the podcast, and the mom just kind of like picked up a pacifier and popped it in the baby's mouth, and she goes, "It doesn't gross you out that I don't wash it first, does it?" I'm like, "No, I don't care." She's like, "Some people really," she goes, "I don't really worry about the germs and stuff." And I'm like, "I don't really worry about that stuff either." But some people are very like, "Oh my God, every little thing." And
I know. Well, you know what? And it's like, I think the science is pretty clear on this, isn't it? Is that that's not the best thing for your baby.
Yeah.
I mean, being exposed to germs and to dirt and to dust and to these things are like protective.
It is.
They
protective.
build up your immune system. That's what the whole point is. And I didn't even know this until I had kids, obviously, that the reason, like your baby is born, right? Most the normal way to be born is like face down, right?
Right.
And the baby's face passes the mom's anus, where there's all of this bacteria. And that's the begin of the immune system building itself up.
It's really important. But you can't tell that to people because they get grossed out.
I know. I was like, oh my God, it's amazing.
Yeah. And that whole film, Microbirth, like that whole thing was kind of based on that premise, from what I remember of it anyway, that, the babies that they deemed to be sicker throughout their lifetime were C-section babies that didn't have that.
Yeah, right. Yeah. And my first son was born sunny side up, so he didn't have that. And actually, with the home birth, I was GBS positive. So, and I was with Jack too. So actually, they give you, in the hospital, when you're GBS positive, they give you like rounds of antibiotics.
They do.
So it was pretty much clearing my system of any like those bacteria that would be, there to protect him anyway. Mm-hmm. And then with the home birth, the way they do it is like a douche of medical grade soap. And so it all gets washed out too. So both of my kids did miss out on that.
Aww.
That first, butt scrape.
Well, yeah, actually, you know what? Mine did too, because I was GBS positive for my first, and then the twins were C-section. So yeah, mine missed out on
so they didn't have that, yeah. So breastfeeding becomes even more of a protective thing.
And then when you're on antibiotics for anything, early on like that, with the GBS positive or anything like that, that stuff is going to be enough to, screw up your antibodies and all that anyway. So.
Yeah. Antibiotics are really, our culture has really become very dependent and overusing of them.
Yeah. Probiotics are a good thing.
Yeah.
For babies too.
When do you recommend probiotics? Because not like right away, right? I mean, you want to have like a gut, just like pure breast milk in their gut, right?
Yeah, the only time I ever suggest a probiotic, I don't usually wander around and go, oh, everybody should be on them. But like if the mom is on antibiotics for something, or the mom is thrush, or the baby has thrush, then I usually say, are you on is either one of you taking a probiotic? And that's usually enough to kind of spur them on. So it might be a couple of months in. But, some people say they can start them as early as they want.
Yeah.
So
so breastfeed when you're sick.
Breastfeed when you're sick.
It's okay if your baby, it's good for your baby to be exposed to all that stuff, and they will continue to be exposed to.
Yes. Don't suffer either. That, I always feel bad for moms. They're like, I don't want to take anything. It'll pass through my breast milk. Don't suffer.
Don't let your ear infection, like I did, don't let your ear infection go on for a week.
No, do not.
To where you become suicidal. No, don't do that.
It's because that's even worse for your baby.
Yeah.
So,
I mean, I don't barely even remember the end of the week.
It's terrible.
Anyway.
And, once you feel better, everybody's better. But if you have any worries, concerns, anything, you can always reach out to us. We'll hook you up.
Yes, the badassbreastfeeder@gmail.com.
Yes. Post it everywhere.
Just send us an email and we'll answer your question.
We will, for sure. And
quickly,
we love to hear from you.
So if you're sick right now and you have a question, just email. I'll get it.
Just get it right now. And then we'll totally hook you up. But we are glad to be back. We had that little holiday hiatus. So thank you for listening and talking to us about sickness. And for Abby,
not sick, but
step it in while she's not feeling good. And we will be talking at you again next week.
Bye.
Bye.